Imagine waking up one day and the world around you looks like a foggy window, blurry, hazy and unclear. For millions of worldwide, this isn't just a bad dream, it is their daily reality. This is the world of cataract. Hello and welcome to my channel. This is Vision. Here in this video, we'll break down everything you need to know about cataract, what they are, why they happen, how they affect vision, and most importantly, how they can be treated. Whether you are here as a student, a curious mind, or someone who knows a loved one suffering from cataract, stay with me to the end of this video. You don't want to miss it. What exactly is cataract? Cataract is a clouding of the eye lens that can cause vision problem, making it difficult to see clearly. And what is this lens? Crystalline lens is a transparent biconvex structure in the eye, located behind the iris, that helps focus light onto the retina, enabling clear vision. When this lens becomes opaque, it blocks light from reaching the retina. This appears very similar to the white floaty look of water coming down from a waterfall, which is also called a cataract. In fact, that is where the name cataract of the eye comes from. Let's talk about the epidemiology. Now you might be wondering, how common is this condition? Cataracts are actually the leading cause of blindness worldwide, particularly affecting the elderly, with its prevalence increasing with age. Cataracts are a major cause of preventable blindness in Africa, with studies suggesting they account for a significant portion of blindness cases, especially in sub-Saharan Africa, due to factors like limited access to health care and socio-economic conditions. But what actually happens inside the eye? Why does the lens become opaque in the first place? Why does the lens become cloudy in the first place? Let's talk about the pathophysiology of cataract. The clouding of the eye's natural lens arises from the breakdown and clumping of protein within the lens, leading to blurry and hazy vision. This process is often linked to aging, but can also be caused by injury, certain medical conditions, genetic factors, and oxidative stress. Some factors can increase the risk of cataract. Don't forget to subscribe to this channel to stay in touch with my new videos. Now, what are the risk factors of cataract? Increasing age, diabetes, UV exposure, smoking, obesity, family history of cataract, previous eye injury or inflammation, previous eye surgery, prolonged use of corticosteroid medication, excessive alcohol intake. What are the types of cataracts? Have it in mind that not all cataracts are the same. In fact, there are different types based on where they develop in lens and when they develop. Cataracts can be divided into congenital or developmental cataracts and acquired cataracts. The congenital and developmental cataracts can further be divided into total cataracts, embryonic nuclear cataracts, laminal cataracts, sutural cataracts, polar cataract, that is posterior and anterior cataract, coronary cataract, blue dot cataract, congenital membranous cataract. Then the acquired cataract can be divided into senile cataract, related with age, metabolic cataract, complicated cataract, toxic cataract, radiational cataract, electric cataract, traumatic cataract, miscellaneous cataract. The senile cataract is divided into nuclear cataract, cortical cataract, intumescent cataract, but the cortical cataract is divided into cuneiform cataract and posterior subcapsular cataract. The metabolic cataract is divided into diabetic cataract, oil droplet cataract, hypocalcemic cataract, sunflower cataract in Low's syndrome. The radiational cataract is divided into the infrared cataract, ultraviolet cataract. Senile cataract progresses through 5 stages, which are 1. Laminal suppression stage, incipient stage, immature stage, mature stage, hypermature stage. But the hypermature stage has two forms, the Morganian stage and the sclerotic stage. Then, what are the clinical features of cataract? How do you know if someone has cataract? 1. Dim vision or blurred vision, photophobia and glare, arrows around light, diffuse yellow haze, uniocular diplopia and polypia, poor color discrimination, black spot in front of the eye, yellow color that eventually becomes a full cloudy white milky appearance. If you notice these symptoms, how can they be confirmed it is a cataract? What are the diagnoses of cataract? 1. Slit lamp examination. 2. Visual acuity test. 3. Fundoscopy. 4. Tonometry. This tonometry is to check the IOP. A visit to optometrist or ophthalmologist is essential for accurate diagnosis. But can cataracts be cured? Now let's talk about the most important part of how cataracts can be treated. The primary treatment of cataract is cataract surgery, where a surgeon removes the cataract that is developing inside the eye and then replace the cataract with an artificial lens. Now, what is cool about cataract surgery? The good news is that cataract surgery is one of the safest, most effective surgeries with over a 95% successful rate, and is similar to having a refractive procedures done at the same time. And what I mean is that during the cataract surgery, not only that your surgeon removed the lens, but the implant they are putting inside the eye can be calculated to help adjust and accommodate for your need for glasses. So if you have myopia or hyperopia and you don't want to be so dependent on glasses, your prescription can be accommodated for during surgery. Cataracts may be a leading cause of blindness, but the good news is they are treatable. If you or someone you know is experiencing symptoms, do not wait. Visit an eye doctor for proper eye checkup. Remember, your eyes are the windows of the world. Take care of them. If you find this video helpful, give it a thumb up, share it with your friends and family, and don't forget to subscribe for more eye health insights. If you have any questions, drop them in the comment section below and I will be happy to answer them until my next video. Keep seeing the world clearly.